In today's session, we will cover one of the most important topics in CT imaging, that is the CT artifacts. Understanding these artifacts is crucial for both exams and daily clinical practice. So let's break them down in a simple and high-yield format. So what are the CT artifacts? CT artifacts are the distortion or errors in CT images that do not represent real patient anatomy or pathology. So they arise due to the physics limitation, machine factors, or patient related issues. So CT artifact is classified according to the physics related artifacts, hardware or machine related artifacts, and the patient related artifacts. So physics related artifacts are the beam hardening artifact, photon starvation, partial volume artifact, ring artifact, and aliasing artifact. Whereas the hardware and machine related artifacts are the detector calibration errors, that is the ring artifacts, tube arcing, helical interpolation errors, and stair step artifact. Whereas the patient related artifacts are the motion, that is voluntary and involuntary, implants, that is metallic implants, obesity that lead to the photon starvation, patient positioning, contrast extraposition. First one is the beam hardening artifact. As we know that the X-ray beam are the polychromatic, as they passes through the dense tissue, low energy photons are absorbed more, making the beam harder, and this produces the classical streaks between the two dense objects, that is the temporal bone and metal. As we can see in this image, this is the streaks artifact in posterior fossa and the cupping artifact in the middle of the head. As we can see in this image, there is a dark area, that is the hypodense area in first image, and this is the after correction. So this is the cupping artifact, and its clinical significance is that it mimics the hemorrhage or reduces the contrast resolution. As we can see in this image, there is a streak artifact mimicking the hemorrhage in bilateral frontal lobe, and there is a left frontal lobe. So this is the significance of beam hardening artifacts, and it can be resolved by the pre-filtration, that is the bow tie filter use, beam hardening correction algorithm using higher KVP and proper calibration. Now the second artifact is the partial volume artifact or partial volume averaging, which occurs when a voxel contains more than one tissue, that is the CT number is averaged, and it appears as the blurring or inaccurate density, and it can mask the small lesions. As we can see in this image, first image showing the volume averaging artifact due to the thick slice, whereas in second image we can see that the thin slice image, and there is clear visibility of the brain parenchyma. So this is the volume averaging artifact, and it can be fixed by the taking thinner slices and overlapping reconstructions. Photon starvation artifact, it occurs due to the insufficient photons reaching to the detectors and mostly seen in the obese patients, shoulder joint and pelvic imaging, and its appearance is the streak artifact in the denser area. So we can see in this image, that is this image of a morbid obese patient showing the photon starvation artifact, and its solution is the automatic tube current modulation, high MA and iterative reconstruction. Ring artifact, it occurs due to the miscalibrated or faulty detector element, and its appearance is a ring centered at the rotation axis in axial CT images. As we can see in this image, this is the ring artifact, and its solution is the detector recalibration and replacement of the faulty detectors. Now another artifact is the Aliasing artifact, and it occurs due to the undersampling and insufficient projection data. So its appearance is the fine streaks radiating from the edges, as we can see in this image, the second image showing fine streaks radiating from the edges of structures, and this is the normal image, and its solution is the higher sampling rate and anti-aliasing filters. Helical and interpolation artifacts, it occurs due to the heavily increased pitch during the helical scanning, and it can create interpolation artifacts. It is also known as the Windmill Artifact. As we can see in this image, there is an interpolation artifact. These are the artifacts, and it simulates the windmill. As we can see in this image, this is the windmill appearance, and its solution is the optimal pitch and modern multi-slice algorithm. Now another one is the stair-step artifact, and it is caused by the thick slices, non-isotropic voxels and high pitch, and its appearance is the jagged step-like edges or coronal sagittal reformats. As we can see in this is seen during the reformation and most commonly seen in the facial bones, mandible, ribs, spine and aorta, and its solution is the thin isotropic slices, low pitch and proper 3D reconstruction. Now the metal artifact, it is a combination of both patient and physics factor, and the very dense material absorb most of the photons as the X-ray beam are the polychromatic, and the denser beam only remain and it forms the severe beam hardening. As we can see in this image, it produces the bright and dark streaks. As we can see in this bright and dark streaks due to the dental implant, and its solution is the metal artifact reduction algorithm, dual energy CT, high KVP, and removing external metal item or objects. Now the motion artifact. Motion artifacts result from the patient motion, breathing or cardiac pulsation. Patient motion is the voluntary motion, and the involuntary one is the breathing, cardiac pulsation and bowel motion. So these are the causes of motion artifact, and its appearance is the blurring, ghosting or double image formation. As we can see in this head CT image, there is a blurring, ghosting and also the double image formation, and solution is the patient instruction to immobilize, faster rotation time, immobilization devices and prospective ECG triggering or gating. Let's know in general the clinical significance of all these CT artifacts. So these CT artifacts can lead to the misdiagnosis like metal sticks, masking hemorrhage, and the underestimation of lesion size, false positives, motion mimicking pathology, degradation of soft tissue contrast, and the limited diagnostic confidence. So as we can see in this image showing the artifact which is leading to the obscuration of the normal anatomy as well as the pathology. After the removal of artifact, we can see that there is a lesion in the left renal area. Now the solution of these artifacts by category. So first is the physics based solution, increase KVP and MA, bow tie filters, iterative reconstruction, thinner slices and dual energy CT. Machine-based solution include the detector calibration, software upgrade, gantry alignment checks, and maintenance of the X-ray tube. And patient-based solution include the removal of removable metallic objects, proper positioning, breathing instructions, using straps or headbands, and sedation for the pediatric patients. So that's a complete overview of CT artifacts, type, causes, significance, and solution. So mastering this topic will improve your exam performance. So thank you for watching, and if you like my video, then like, share and subscribe.